What did they say your original diagnosis was?
Okay, well, to give you a little background, in early May of this year, I noticed blood in my urine stream. I went to a urologist. They did a cystoscopy, and they cited a tumor in my bladder.
Mm-hmm.
They then we had surgery to remove that tumor, and I will never forget, Lynn and I were in the doctor's office, and he said, well, I think I got it all, but, with this type of cancer, it wouldn't surprise me if there was little cancer cells remaining in the wall of the bladder. And for that reason, you have a risk there. So you have options. You can have surgery to move your bladder, and there's different kinds of surgery there, which did not appeal to me. You can have chemo or radiation. It's like, wow, what's the lesser of all those evils? And then Lynn, one night, was searching the internet. She had been talking to the Lord, and he directed her to your website, Dr. Nemec. And so I've been having a lot of green juice, had to change my diet. And I am a type 2 diabetic. My glucose level has dropped dramatically. Still work to be done, but it's dropped dramatically. And just 2 days ago, I had a PET scan, and it showed that there was no cancer that they could see in the bladder, and there had been a suspicious lymph node that lit up on the scan.
The prior scan.
The prior
scan back in May, and it had diminished by 2 centimeters.
So when all this happened, it was a shock, when you hear you have something like that. And what I will say is the tumor was the size of a $50. And one of the things, when the doctor removed it, he did say what Jim said, that he thought it would be in the wall of the bladder. So we had to wait 2 weeks for the biopsy to come back. And the biopsy, prior to doing the surgery, I requested a PET scan. And that's unusual. They normally do a PET scan after surgeries, after the biopsy. But our daughter's in the medical field, and I just said I'd really like a PET scan beforehand. And they said, well, it's not covered by insurance. And we said, well, we'll go to pay out of pocket for it. And it turned out the insurance covered it, which was a blessing. And because we wanted to know. Well, so before the surgery, the day of the surgery, doctor said there was a lymph node that was enlarged by the left aortic artery. And
the aortic artery was at some distance from the bladder, where the concern initially was.
Right.
So the doctors were concerned that, that cancer is spreading maybe spreading throughout your body.
So we knew that there was a lymph node, but there was no lymph nodes around the bladder or anything. It was just there. So the only reason I wanted to bring that up was because we knew that in advance. And then when the biopsy came back and they said that it was a T2, N1, high-grade bladder cancer, T2 means it's in the wall of the bladder, and even though he got the tumor out, and N1 means there's a lymph node that's having some activity, and then high-grade bladder cancer. So then what happened was we came here after, like Jim said, I was praying, the Lord brought us here, and we have seen doctors, 4 surgeons, and a total of 5 radiological oncologists and 6 medical oncologists, because each surgeon has 2 other oncologists that work with them. But we did that only because it's kind of like what you're supposed to do, because they tell you to go here or there. Jim, since Father's Day weekend is when we first came here, so we started the routine
4th of July.
right before
the treatments, the therapies, the diet, the lifestyle, the supplementation.
Yeah.
Right.
And all of that we started, and then we saw the last medical oncologist on Wednesday of last week, and it was amazing. And that was University of Chicago, but what was interesting is the doctor said, Jim, I'm really not comfortable treating you with chemo at this point. I'd like to have you have another scan. And we were like, thank you, because none of the other doctors wanted to do a scan. Isn't that amazing? And that's really what
confirmation.
And that's what he wanted too. He wanted another scan.
I felt entirely comfortable with that.
Yeah, right. And so he had the scan, and we'll have another appointment with him. Today is Wednesday.
Tuesday, I believe it.
Today's Wednesday, whatever date it is today, the 18th. And we'll have another appointment next Tuesday. But my daughter got the results from the report. Mm-hmm. So he had a PET scan Monday, 2 days ago. We got the results yesterday. And what she said, she's an MRI technician and she's in that business, and she said it basically said the lymph node was a 1.8 centimeter and now it's 1.6. And there's no activity anywhere else in his body, and they did a scan, a full scan, right. And no other lit up lymph nodes anywhere, and there's no metastases in the bladder. Which that's
all
amazing.
Good.
Yeah.
So I had to share that. But
I'm so glad you did.
So
thank you.
In closing, I wanted to impart some encouragement for those of you that have been told some grim news. My wife and I visited Rush University Hospital, Northwestern University Hospital. We visited Cancer Treatment Centers of America, and we consulted Joliet Oncology and Hematology Associates. They all proposed a minimum of chemotherapy. Some of them proposed surgery. And I just was relating to Dr. Nemec how blessed I feel that I didn't go ahead and take their advice. And I'm not belittling or no disrespect to our competence and our medical people, but I could have had my bladder removed if I had taken their advice, and for what,
So as Jim was mentioning at the end about the medical field, every single appointment, and it was daunting. I'd go with them all the time, and they tell you the same thing over and over again. But I do want to mention a couple of things. They actually have a website that the cancer doctors use, right. And I think it's called the National Cancer Association or Institute website, and they enter in the information on the patient, like what the biopsy results were, whatever was going on, anything that needs to be put in there. And then it spits out a generic plan for the patient that's basically from the computer, right. That tells, so every single doctor more or less said exactly the same thing. But the first few surgeons, we didn't know they were doing that. But then at the end, after seeing all these people, now they're turning their computers around and saying, this is what we do, and this is who we put it into, and it tells us the treatment plan we should use on you. But the point of the story is, every appointment he would ask, well, doctor, if I do this, so it was 3 months of chemo. Mm-hmm. And then they'd come back and look and see how he's doing, and possibly remove the bladder for putting the allele conduit, which is a pouch, or doing the other two options, which are using the small intestine, bladder removal and reconstruction with the small intestine. So that was an option, or then option 2 would be chemoradiation together. So he asked questions, how much of a, what will this give me in my life? Like, what percentage? And it was 50-50. 50-50 for Jim with his situation. That's what they said. So we were thinking
50-50 without or with?
No, with the procedure.
With the treatment.
50-50 with.
And,
with the treatment.
So what are the odds of what is the survival rate? What are the odds of recurrence? And in my case, as Lynn said, there was some 50 or 60%. Those aren't good enough odds to have my bladder removed to have invasive surgery. I'll go with Dr. Nemec.
So we felt it was a big, it's a crapshoot, excuse my language, when you do that because they can't give you an answer. They can't give you an answer because they really don't know themselves. And it's more like an experiment on each person's body. And so that's what is kind of hard but that's what I wanted to share.
That's beautiful. Well, thank you so much for
Thank you
sharing.
for being here.